Hello, everybody. Welcome to Sostento Live. I am Joe, your host for today, CEO and founder of Sostento. I'm so excited you joined us today. If you could put into the chat, if you're able to, where you're joining us from, what organization you're with. I see we have a lot of some of our frontline health workers here. Let's see. We've got Rachel from Ethne Health in Clarkston, Georgia. Hey, Rachel. Ethne is one of our pilot clinics that are currently running some of these rides. So great to have you, Rachel. One of our partners from Angel Flight East. They don't do rides, they do flights. Angel Flight East, really cool organization, does free flights with amateur pilots to access healthcare. Let's see, we've got Laquat from the Ibn Sina Foundation in Houston, Texas, one of our lead vaccinators in our network. Hello, Laquat. Hope everyone's going well there in Houston. Brianna, Good Samaritan Health Center in Atlanta. She was one of our guest speakers at our first Sostento Live about preparing for the COVID fall wave. Hey, Brianna, how you doing? Also, our leader in rides from our pilot. Hi, Brianna, how you doing? Let's see, we got a group in Florida. Our thoughts are with you in Florida. I got family in Florida. I hope there in Bonita Springs, you got your rain jacket. You're all ready. You're somewhere safe. Lots of other health workers. We've got Vicky in Virginia. Hey, Vicky, how you doing? Our PR partner, Pearl. Pearl can do it. Pearl Gable from Kivit. Hey, Pearl, how you doing? New Jersey represent. Good to have a fellow New Jerseyan here. I am coming in live from New Jersey. Let's see, we've got Good Shepherd Clinic in Georgia. Our friends in Illinois, the DuPage Health Council Coalition. Hey, Karen, how you doing? Many more I see are calling in, joining us. Let's see who we got. Melanie from the Amerisource Bergen Foundation. Hi, Melanie. How you doing? Thanks for joining us. Longtime supporter of Sostento. Great to have you, Melanie. Let's see. We've got Amanda from the Public Health Right in Morgantown, West Virginia. West Virginia, where Sostento began its work back in 2019. Good to have someone from West Virginia here. I see more comments coming in. Let me get one or two more. Hi, Cheryl. Cheryl White, Center Volunteer in Medicine in State College, Pennsylvania. Also one of our top vaccinators in our COVID network. Hey, Cheryl, hope you're doing well. And I see that there are many others here today. So thanks, everyone who's been joining. Please keep putting your questions and comments in the chat. We're so happy to have you here. To start, why are we doing Sostento Live? What is this all about? Well, since December of 2020, Sostento has been running webinars with free and charitable clinics across the country to talk about COVID, to share best practices, to get ourselves through the unprecedented vaccine campaign that we have been doing together, and really just to uplift. So Sostento, it's actually an Italian word that means to uplift, nourish, and sustain. And every month we would come together, listen to some music, talk about what we were challenges that we were facing. And earlier this year, we realized there was so much knowledge and so many things that we were sharing privately in our monthly webinar that we should start doing a public version of that webinar. And so that's why Sostento Live Insights from the Frontline was created. That's the purpose, is to start sharing with a wider audience all the things that we've been learning with our frontline health workers, the things that we've been doing. And we had our first Sostento Live in August. It was about preparing for the fall COVID wave. It was a really amazing session. We had a professor from Boston University. We had clinic leaders all talking about what they were doing to prepare for a potential fall COVID wave. So that brings us to our live session today, the Free Rides Revolution for Charitable Clinics. And how did we get to this live session? Why are we talking about free Uber rides? Well, really, this story begins back in 2021, the first half of 2021. And we were preparing for an unprecedented vaccine campaign to create access to the vaccine. Sostento's kind of role in the vaccine kind of deployment was helping, individuals that were hard to reach, individuals that maybe would have difficulty getting access to the COVID vaccine, and working with free and charitable clinics that were helping us to reach those populations. So you can see that there's a story out there that was actually written about Sostento during that vaccine kind of work, which was that there were people who actually wanted to get vaccinated, but weren't able to get access. And I think that that was, something that a lot of people we're like, really? There are people that can't get access to the vaccine? Isn't there a vaccine, mass vaccination site in every corner? Isn't it really simple to go online, make an appointment and go? But what we know, working with our free and charitable clinics that serve populations and families living below the poverty line, that there are a number of barriers to accessing the vaccine that, maybe a person who lives in the suburbs or in the city has access to their own car, constant access to the internet, would say, oh, it should be really easy. I remember talking to some of my family and friends and saying, well, we're working on vaccine access. And they said, well, why would it be so difficult to get to a vaccine site? Shouldn't that be simple? But we know that transportation is a barrier to care for many individuals, and that free and charitable clinics that we work with often are reporting to us the challenges that they face around transportation. That transportation barrier can include that there's no public transport, so they don't have an easy way to get to the clinic. They may rely on a ride from a family member or a friend. And if they're working, so a lot of folks that are serviced by free and charitable clinics are working 9-to-5 jobs. And it is not easy to get to the clinic when it is open if you have to spend an hour or two trying to walk, take a bike, take the public transport. And so we were hearing again and again that transportation was a barrier to accessing the COVID vaccine. And for me, I actually understood that because transportation was an issue to care before the pandemic. I've been working on the transportation issue my whole career. I spent 12 years working in public health emergency response all around the world. And transportation is an issue if you're in a rural area of Africa or if you're in an urban area of Atlanta. Transportation can be an issue, and I think many of us take for granted that we have easy transportation to get access to our healthcare, but that is not true for many members of our society. And we're going to be talking a little bit today about how we overcame that transportation challenge. So we were really lucky when we saw this transportation challenge and we started to think, how can we overcome it? We found out about something called the Vaccine Access Fund. This was a fund run by a group called LISC, Local Implementation Support Corporation, LISC, and they brought together 3 companies, PayPal, Walgreens, and Uber, to launch a fund. And this was not a small fund. This was a big fund, $12 million to help with the transportation challenge and accessing the COVID vaccine. And so Sostento was lucky enough to participate in this LISC pilot, this project. We created a free vaccine rides pilot out of it. And a year later, the results were extraordinary. I want to talk about those. I think I'm going to bring up some of the stats, the results of that 1 year of rides that we've done. Maybe we can make that a little bit bigger. There you go. So over a 1 year period, you can see that we engaged 15 different clinics to run rides. Between those clinics, we had 49 different individuals that were deploying rides. So we have 49 different trip coordinators at about 6 different states, 15 different clinic locations. And you can see we are so proud to say that we were able to implement over 6,000 free rides. These were rides that were at no cost to the individual that utilized the ride, at no cost to the clinic that deployed the ride. A total amount of those fares combined over $135,000. Thanks to the LISC Vaccine Access Fund, we were able to deploy over $130,000 worth of rides. That is just such an amazing, figure. As well, we also like to kind of look at some fun stats there. Those rides, the time spent in the car, over 1,800 hours spent in Ubers getting access to healthcare. As well, those rides have gone a distance of over 2 times around the earth. So those are just some of the fun statistics to look at. We can also look at a map and see where all those different rides took place. So we can give you a little look at the geography. And I think the important part of this to share was the intervention that Sostento was able to create with the help of LISC and Uber and others. We were able to find a way to overcome some additional barriers to using rideshare technology. So we understood that many of these individuals who needed transportation, who needed rides to get to the clinic to get vaccinated or to get other kind of COVID care, we know that a lot of them had never used an Uber before. They didn't have the app. Some of them didn't have a smartphone. They weren't able to get it set up. So we were able to, using UberHealth and their platform called UberHealth, and we'll talk about it a little bit later, to actually empower the clinics to order the rides for the individuals. And Sostento was able to train these clinics to help them educate their patient base about what was a rideshare, how did it work. At first, a lot of individuals were like, well, where's the little taxi sign on this ride that's coming to pick me up? I don't understand. So we learned there are special interventions on top of the rideshare technology that clinics needed to do to make sure that they could use that amazing innovative technology to increase access. So over a year, we saw our rides grow and grow. We saw all kinds of creative uses of those rides that we'll talk about with 2 clinics. We'll be on a little bit later talking about how they use those rides. And so at the end of this first year of doing it, we realized that this is a story and an intervention worth sharing, one that we want to see scale across the country. We believe so many people can benefit from it, because never in my career have I had health workers call me and tell me about how a new technology tool was a game changer for their clinic, how this is something they needed in perpetuity, how this is something they need to use beyond COVID vaccine in other ways, and how they all said, Joe, get me as many rides as you can get me, because this is helping people in ways that you can't imagine, not just for my patients, but for my staff. There are less individuals showing up late for their appointments. There's less individuals missing their appointments. When they're here and I need to maybe schedule them for their secondary vaccine, I can do that and say, you'll have a ride. Don't worry, you can get here on time. So this intervention, this innovation was just worth sharing. And that's why we decided to do the Sostento Live. So that's a little background on it. Before I bring out our first speaker, our special guest from Uber, who's going to tell us all about this, I want to say a few thank yous to the different organizations and the different stakeholders that made this project possible. First and foremost, I want to thank HRSA under the Health and Human Services Agency. They have helped us staff up this program. They have allowed us to make sure we have a full team. A lot of them are here today. We have a full team that makes sure that the clinics are supported, they're trained. One thing that Sostento also does is we cover all the accounting and the financials for those rides. So the clinics, all they do is order the rides. Sostento covers the whole cost, all of the accounting, all of the back-end work. We train, we troubleshoot, and we are able to do that because HRSA helps support our staff to do this vaccine access work that we have done with the ride. So first, I want to thank HRSA for all their support. We're helping deliver vaccines actually across 100 different locations in 16 different states, thanks to HRSA, and they're really the one that made us able to do this. So thank you, HRSA. I know Emmy, Devon, Fraser, the whole team there. I think some of them may be here today. Thank you for making this work. Second, I want to thank LISC, the Local Initiative Support Corporation, again, who made it possible for us to offer this free to the frontline. Again, all of the clinics that are providing this ride service, it is at no cost to the clinic. It is at no cost to their patients, and that is because of LISC. And I want to thank Julie, Faith, Phoebe, the whole team at LISC. I know some of them may also be joining us. I want to thank you for covering that ride's cost, for opening up this opportunity to learn about this intervention and what we could do with UberHealth. So thank you so much. I also want to shout out the 15 clinics that experimented and piloted with us to get this thing going. We have free and charitable clinics in Alabama, Georgia, Texas, Mississippi, Tennessee, and Wisconsin that have done the rides. They're in urban areas, suburban areas. We even have some rural clinics doing the rides. They really learned with us, gave us feedback, and it was so exciting to see them continue to improve the number of rides they were able to do each month and advocate with us for the continuation of this service. Of course, lastly, the Sostento team. I know they're all here. We have folks, experts in design, tech, implementation. Oftentimes the Sostento team is quiet, working in the background. We put the health workers out front. They're the stars, but the Sostento team all made this possible. And I guess this is our transition here is Uber. Uber made it possible. So without further ado, they're the honorary guest today. Let's bring on our special guest from Uber to talk about this, how this all works. All right. Hello, everyone. I want to welcome Leor Shtull-Leber to the stage with me from UberHealth. We are lucky to have her here today. She is the Senior Operations Director at UberHealth. She's been our partner on this project from the very, very start. She's helped us get going so much. Leor, welcome.
Thank you, Joe. It's a pleasure to be here. Thank you for having me.
Oh, absolutely. So let's jump right into it. So I was familiar with rideshare apps, obviously, before we did this project. I had used them, but I had never heard of UberHealth before and what that platform did. So maybe if there's some people listening in here who don't know what UberHealth is and are learning about it the first time, can you tell us a little bit about the platform and what it's able to do?
I'd love to. So with the goal of trying to improve care delivery, UberHealth started in 2018 as a way to enable organizations like the free clinics who are on this call and that you work with to tap into Uber's marketplace technology through a HIPAA-supported API or web dashboard. It's a patient access tool. It's a population health management tool, really with the goal of trying to make patient outcomes better. So what does that actually mean? It's a way for organizations to tap into Uber's logistics expertise to actually offer logistics for your patients. So that's a coordinator who can arrange a ride on behalf of a patient. It's a coordinator who can arrange a delivery on behalf of a patient. And the way it very practically works is that a health worker or a coordinator will use that web dashboard to request a ride or a delivery. It will tap into a driver from Uber's network or from one of our partner networks. The rider or the recipient will be able to get a text message or a phone call to track that ride. And then the coordinator can track that ride and follow it in real time, also intervening if necessary. I think what's important to call out is that those riders, they don't need to have the Uber app. They don't need to have a smartphone. They don't need to have a credit card in order to benefit. And we have a huge range of organizations using this today. There's over 3,000, including nonprofits. We're very lucky to have Sostento on that list. Clinics, hospitals, clinical trials, home health, insurance, transportation brokers, providers, the list goes on as a quick overview. Yeah, and this is on the dashboard here. You can see the interface that's used to arrange the ride on our web dashboard. So coordinator just puts in the pickup and drop off address, chooses how they want to arrange it. It's sort of like the Uber app, but on a computer view.
Yeah, that was something that we had thought about using the rideshare technology early in the vaccine deployment, but we quickly saw that there were barriers for an individual patient in the community who had never used rideshare before. There's a huge technology training challenge of how will we get an individual to make sure they have the smartphone, they have the app, they've registered for the app, they know how to hail the ride, and that was kind of a lift that we knew we wouldn't be able to do at scale. And that's where the UberHealth platform is more of like the clinic deployment view, right? Instead of the patient view, it's a clinic view. And like you said, it allows the clinic to put in the address for the pickup, to put in the time for the pickup. And it was like a huge, huge difference when, as you mentioned, the patient themselves didn't need to have the smartphone, didn't need to have the Uber app. Oftentimes we found that the individual didn't know what rideshare technology even was. And we actually we realized that the first time the ride was ordered for an individual, the dispatcher from the clinic should stay on the phone with them and say, yes, that's the car. Yes, it's not a taxi, but it is your ride. They're like, whose car is that? And you have to answer those questions. It's really, trust is something that we have to work on with our constituency to get them to use a service like this. And UberHealth's platform allowed us to build around that technology and, like you said, the pool of drivers. That has been a huge difference maker. The clinic doesn't need to have their own dedicated car, their own dedicated driver. It really taps into that, that Uber driver pool that, I might use when I'm on in the city to get to the movie theater or to the restaurant and to get around. But now it can actually be used. Those same drivers, those same Ubers can be used to get access to healthcare by ordering them for the patients.
Exactly.
So, Leor, you've actually been with Uber for 8 years. So you've seen the organization evolve and change over time. I'm wondering how you can walk us through how you've seen the rideshare technology, progress over those 8 years. And tell us about your journey at Uber.
I'm curious how many miles around the earth I've done in an Uber at this point, or times around. Yeah, for context for people, when I joined Uber, about 8 years is a long time at a tech company. It may not be a long time in the healthcare clinic world, but when I joined, there were about 2,000 employees. and now there's 30,000. So a lot has changed. But to answer your question, I think I'll give two little small anecdotes that I think give the picture. The first is the first time I took an Uber ride. I was visiting a friend. I was a recent college grad, visiting a friend in Boston, and we were going home from a party. At the time in Boston, there was only Uber Black. There was no Uber X, which is the economy version. And it was raining, and she goes, "Oh, I got this. I have this new app." And she pulls out her phone and she presses a button, and this like black shiny SUV shows up to take us home. And I go, "That's awesome, but it's fancy and I'm never going to use it." Then a few days ago, I was with a friend, and when you work at Uber, people tell you all their Uber stories. And he goes, "Leor, I was just at a wedding and it was really cool. Instead of the family getting a shuttle, they gave us these sort of promo codes to get Uber rides, and it was $25 off the ride. And the thing only worked between the venue and the hotel, and it was really easy." And I said, "That sounds like our vouchers product," which actually the health team is using on a research project right now. The exact same product to give out Uber Eats vouchers to Medicaid recipients in Georgia to access food and convenience items. It's very cool that the same product can do both of those things. And I think those two bookend stories for me is how rideshare has changed. We've gone from an app that is what you use to get home from the bar to a company that can think about how can this technology actually help real problems in the world? And more specifically, how do we build tools that are industry specific to solve those problems? So for example, Uber has business tools, enterprise tools for business travel. There's an entire truck and freight industry. And obviously closest to my heart, there's the healthcare use case. And we've recognized that there are access challenges in our healthcare environment. So how do we build tools that are specific to that are HIPAA supported, that really solve that problem? And I think in contrast to 8 years ago, when it was get home from the bar, Uber has started to be a lot more community oriented and society oriented to think, how can we use our technology to actually help people? And I think that's a huge change from when I started at the company.
Really cool. Yeah, I agree that the technology, once you kind of start using it, the creativity of the different use cases becomes clear. You know, like even when we started this project, it evolved. At the beginning, we're like, oh, it's just going to be used for individuals to reach the clinic. And so that's how we're going to structure it. But quickly, we had clinics saying, hey, can we order an Uber for a staff member to do a home-based vaccination? They're going to a place where there's no parking. The staff member doesn't have a car. Can they use that ride to get the staff member to the home-based vaccination? Yes. We had another clinic that came forward and said, hey, we need a translator of a very specific Afghani dialect to do a vaccination event. That individual that would be our translator doesn't have a ride to the event. Can we use the ride for the translator to come? So I could see how things can evolve really quickly, because as you start using this kind of technology, the different types of use cases become clear. And I'm sure, like, as a company, it sounds like you're still at the precipice of all the different, types of use cases that this rideshare technology might allow.
Totally. Yeah, we're thinking about more and more ways, even within healthcare, that we can be more specific and help. Is it just transportation? Delivery is an entirely new industry that's also an access barrier in healthcare. So we're both in terms of use cases, but also features, and how do you build for the needs. And as we work with organizations and hear feedback, we're trying to always improve the product to actually make sure that we're being the most helpful to organizations.
Mm-hmm, absolutely. All right. So we've kind of given everyone the exciting look at what the platform is and how it's evolved. So we might have some folks, live here who have not started using this tool, but are thinking about it. What advice would you give to a health provider who's just starting out with rideshare technology, who's just starting to think about deploying it? What are some things that you've seen are very important first steps for getting going?
I think it's spending the time up front to think about workflow and policies and implementation. The actual tool itself, you saw the screenshot, it's actually fairly easy to use. It asks you for an address and for a name and a phone number, and you type it in, you click request. And I think, so we have training and we have resources. Sostento has created amazing resources as well. That's fairly easy. I think the organizations that are really set up for success are the ones who think about in advance, how and when are you actually going to use this? What's the eligibility for patients to get a ride? Does everybody get a ride or only certain patients? Who's deciding that? Does someone need to be an approver if the ride is particularly long? Joe touched on this also, but expectation setting for riders, creating scripts for people so that they know what to expect, I think is a huge one. I think thinking about even identifying sort of particularly high risk no-show patients and saying, okay, if we request a ride for this particular patient, should we make sure that someone is monitoring the ride the entire time from A to Z? If you don't have the benefit of working with Sostento, who is going to be doing all of our billing? And the more that you can think through all of those processes up front, it's just going to be way smoother for you. And I think Sostento has actually been really amazing in some of the onboarding that they've created in setting organizations up for success, and have done a lot of that for them. One of the things that I've seen in the Sostento onboarding, which I really think is a fantastic idea, is having the coordinators themselves go through the experience of getting a ride so that they can see exactly what, feel it, experience it, and then they're in a much better position to help the patients go through the exact same thing. So I think it's, yes, you can learn how to use the tool, but it's all of the other pieces. And Uber can help provide a list of questions to think through, as can Sostento also. And that's really what sets organizations up for success.
Yeah, no. And how that like showed up in our data is with our first cohort of clinics that came through, what we saw is that every month they would double the number of rides they would do. You know, on day one, they wouldn't come and do all the rides. We actually said, oh, I think it looks like they maybe have maxed out their rides. And the next month they would double. And I think for about 4 to 5 months in a row, we would see those rides double. And when we kind of looked back and learned more about it, it's just what you spoke to is like, if you're thinking about using the service, how is it going to integrate into your operations? And I'll highlight 2 ways I think you kind of spoke to. Number one, you will really want to have a dedicated person who is going to be, you know, overseeing the service, and someone that may be the same person depending on the size of your organization, and maybe others, who's going to actually be ordering the rides for the individual. Because remember, the patient is not doing any of that. There's someone who's putting in their address, putting in the pickup time, and then on top of it, the first time they use it, maybe need to be on the phone with them to coach them through it and get them to the clinic. So that upfront investment of how it will integrate into your operations and who will be running it is really important. Because I think on the back end, you end up, you know, reducing your burdens, less no-shows, less late patients. Once someone's used it and they're using it multiple times. So on our stats I showed before, we had 6,000 unique rides, but 1,500 unique riders, which means individuals are using it multiple times. It gets easier. But that upfront, how will this work at our organization? How will we integrate it in is really important. And then the other one you mentioned that I've heard clinics do is a screening question of an individual when they're signing up for an appointment. So you're screening them to know, is transportation a barrier for them? If so, you can screen that. And then once the individual is there and you screen them and they need the ride, you can also set up appointments into the future with the rides. You can also start scheduling ahead of time. So some of those things that I've seen, like just thinking through those operational integration, like getting the hang of the tech tool, it's pretty, I think, Uber tech companies, and it's obvious that it's a very easy to use tool, but it's how does it integrate into your operations? So yes, absolutely. Those are some tips. So the next one I want to talk a little bit about is about the types of rides that you've seen be most successful, Leor. So we've worked with you through the Vaccine Access Fund and LISC on improving vaccine access. We've done that, rides to vaccine appointments. We've done rides for staff and community members to do different kinds of vaccination events as well. We use the rides to get people to appointments to get educated. But can you tell us what are the other types of health access rides that you've seen be successful?
Yeah, great question. So definitely the predominant use cases are getting people to outpatient appointments, preventative health appointments, and probably secondarily followed by emergency discharge as sort of across the board, hospital discharge, both emergency room and inpatient. But we see an increasing use of these rides in 2 categories. The first is just sort of wider social determinants of health use cases. So people arranging rides to get people to workforce programs, to education programs, to the grocery store, to the bank. And a lot of organizations increasingly focusing on areas of social isolation for older adults, moving older adults, whether potentially to appointments, but also maybe just to an excursion or to a social gathering, really expanding the view of health as just what happens within the doctor's office to how do you live a healthy, fuller life. For example, I can think of a summer day camp for kids with cancer that they used UberHealth to bring the camper, the kid, and a parent to the camp. And then they sent the parent back to where they needed to go, whether that was back home or back to work. New York City homeless shelters have access to UberHealth to arrange rides for people to go to urgent care centers if it's not an emergency, instead of using unnecessarily expensive and unnecessary ambulances. So those are some of the sort of SDOH use cases. And I think another growing area, and Joe touched on this, is not just for patients, but moving staff as well. So that could be the home visit use case, moving clinicians or home aides to people's homes. We also see hospitals using it for staff transportation. That could be particularly hospitals that have parking issues and not enough parking spaces for their patients. They want to prioritize parking for patients. Can they use UberHealth to move staff between facilities or even to and from work? So those are the most common use cases of UberHealth today. I think it's appointments, sort of the core use case, SDOH, and then moving staff.
Yeah, I'm really excited about the social determinants of health angle. We know that an individual, for example, that may, have chronic disease and need chronic disease management, showing up for your appointment may help, but may not get to the root of the issue. The ability to use some of those rides to maybe visit a nutritionist, get to the supermarket, and do those things. It really starts talking about serving the whole person, and getting them beyond just that acute management. So yeah, that's definitely an interesting one. Are there any surprising or unique use cases that you can think of? So you've gone over a bunch there, but are there any outside the box type of rides that you've?
Great question. Someone on my team was just telling me about some sort of robot that's built for social isolation as a companion for older adults. And they're going to integrate UberHealth into it, I think, so that the older adult can do like an auditory request for a ride, and the little robot will be able to request a ride for them. So I thought that was pretty creative. And then another one is there's an organization that does some sort of vacation medical travel companions, where they have staff that actually go on vacations with people who need a caregiver with them. And they'll be doing all the rides while somebody's actually on vacation. So speaking of getting outside of the clinic. So those are two that come to mind off the top of my head for that one.
Yeah, that reminds me of something interesting that I've been hearing some of the clinics talk about, is thinking about, could we actually have the Uber come to the clinic, pick up somebody, and then go out and say deliver prescription meds, go, I think one of the things with the patient population served by free and charitable clinics, again, I mentioned trust before. If the first time they're even needing to use the Uber ride, maybe it is an unhoused population or someone who really has a low level of trust and they're not sure about getting in the vehicle, you could actually have the Uber ride come and pick up the staff member at the clinic, bring them into the community to get that individual just for the first ride so they can get comfortable with it. So that was
I love that idea.
So, there are really different use cases, and I can't wait. We're going to have our clinics on in just a little bit, talking about what they've been using it for. So we'll hear actually some frontline health workers that are using them, and maybe they have some additional stories. So you mentioned that these robot rides. So obviously the UberHealth technology itself is still developing. Is there anything we might expect from UberHealth and the technology in the future? Is there anything you can share, around the tech that we might get to see in the near future?
Yeah. So I think you touched on sort of what we're thinking already, which is that if somebody doesn't have a way to get to their doctor's appointment, they may also not have a way to get to a pharmacy or get to the grocery store. And right now, solutions for all those things are very siloed and fragmented. You might have different tools that you use to do different things, or maybe you don't have tools to do some of them. So we want the UberHealth platform to be a single platform for all healthcare needs and all logistics needs. So we want you to be able to go into UberHealth to request a ride, but also to request a prescription delivery and have somebody, whether it's a caregiver and the patient themselves or having a driver just go to the pharmacy, pick it up and drop it off at someone's house. We want you to be able to go to UberHealth to also request a grocery delivery. We have delivery technology at Uber already for Uber Eats, and we want to incorporate that into the UberHealth world so that really it's a one-stop shop for all of your logistics healthcare needs. So we are very actively working on that and hope to be able to announce something on that soon to you guys as more of a one-stop shop, not just for rides, but rides and other types of logistics needs also in one place.
And I had one question, just because you mentioned robots. Do you think in the future we might see self-driving Uber pickups for patients where, maybe we won't even need the drivers or worry about the drivers, but we might actually have it self-driving? Do you think that's something we might see in the future?
The tech industry at large is certainly working on self-driving cars. I think when it gets to a place where that has all of the necessary safety standards approved by government, and that becomes the way rideshare technology works, then UberHealth will certainly, look into that. But hopefully no lawyers are yelling at me right now. Certainly not in the immediate future, but it's certainly where technology is moving towards.
Yeah, I mean, I think maybe 10 years ago, I would have been asking about flying cars, but I think that the self-driving car seems a little bit more tangible in the future. We do have a question that I'm going to put up on the screen so we can chat about it quickly. So Leor, who joined late, and there was actually another question from Robin I saw, is asking about, are the rides actually free, or is there some sort of cost associated with the rides with Sostento or Uber? So I'll answer that from my point of view,
Sure.
Leor, and then you could talk about how some of the different financing models that maybe that you've seen other health providers pursue. So Lori, on the Sostento side, we did fundraising to cover the cost of the ride for the free and charitable clinics. So to date, those rides have been covered by the Vaccine Access Fund, which was provided to us by LISC. So pretty much we raised grant funding, and then we cover the costs for all of the clinics. We cover the cost of the trainings, of the administrative support, the technology training support. And we know that especially these free and charitable clinics that we serve, they do about 80% uninsured and non-billable services. They're a complement to the more kind of widely known, sometimes federally qualified health centers, FQHCs, that do about 80% Medicaid and 20% non-billable. But with our constituency, we've been doing the rides we have done all of the fundraising to cover the cost of those rides, to do the training. And we're continuing to look to raise more funds to have more clinics come in. So Lori, the answer, and I know Robin, you asked this as well, we did it through our own grant fundraising. But Leor, I'll let you talk about maybe some other financing models that you've seen.
Right. So if you're lucky enough to be a free and charitable clinic as part of the Sostento network, that what Joe just described applies to. For other organizations, you do pay for the rides. The costs are the same for the most part as the Uber rides that you would get through an app. So there's no minimums, there's no setup fees. You pay for the rides you take. It's a pay-per-use tool, so it's free to have the dashboard in your back pocket in case of emergencies. Organizations that use it, some of them do find their own funding, specifically nonprofits who will get other independent grant funding. For most of the organizations and more in the clinic space and hospitals that we see using UberHealth, it's just worth it for them operationally to pay for the rides to cover the cost of a no-show. If it is a billable appointment, someone doesn't show up, you can't bill for it. And we've seen that for the most part that organizations are finding that they actually still net out positive after the cost of the ride by keeping patients coming, both keeping them healthy, but then also actually showing up to their appointment. So that's how it's working for the organizations outside of the Sostento network who are billed for the rides, either on a per trip or on a monthly basis, depending on your preferences.
Great. Thanks, Leor, for that. I see also some individuals asking, how do we get involved? We're a free clinic. One way to get involved is talk to Sostento. We currently have a waiting list of clinics that we want to add to the program as we do our fundraising. And as we further design the service, we're going to be allowing more free and charitable clinics in. However, if you raise your own dollars, you're able to sign up directly on the UberHealth platform. That's correct, Leor? You just go on.
Yeah, absolutely. UberHealth.com.
Yep, UberHealth.com. So that's how you can get started if you do have funding or you want to get going. So with that, we're going to thank Leor. We're going to take her off the stage here. We're going to have her back for a roundtable discussion at the end. But thank you, Leor, for introducing us to this service, for all the support you've given Sostento and to the clinics that have benefited. We appreciate it.
Thanks, Joe.
All right. So we are going to have a short intermission, a short break. So this is a good time to use the bathroom, grab a drink. If you are at your computer or your phone, we're going to play a short video. And if you're in the chat, let us know if your patient population, those that you serve, are facing transportation barriers. Let us know which organization you are, where you would like to do rides, anything you want us to know about the need for transportation in your community. The Sostento team is here. We're going to be documenting that. So we're going to go, again, to a short 5-minute break. When we come back on the other side, we're going to be bringing in the leadership from 2 frontline clinics, one in Montgomery, Alabama, one in McAllen, Texas, that have been doing these rides for a full year. So we're going to hear directly from the frontline health workers how it's going, and then we'll have a roundtable discussion at the end. We'll bring back Leor, but let's go to our 5-minute break.
UberHealth. In the past 6 months, I've administered over 150 rides. One patient who frequently uses UberHealth, but unfortunately he doesn't have access to his own car. So having Uber available for him, he can call in and get his meds, and we can schedule his appointment each day that he needs to. To be able to come here without having to pay anything has helped him tremendously, and he's forever grateful for it.
The Uber portal has been invaluable for us to be able to get people from their house to the vaccination site and back. And it takes away a major barrier for people trying to get this work done. But we've also had to use it to get our staff to do homebound vaccinations, and it worked beautifully. Everything was already programmed in. The timing was perfect. The staff person was super happy because she could still get her work done. And then the clients just really appreciate us going above and beyond to get that done.
All right, hello. We are back from the break. Really great to see some of the testimonials, videos from of our clinics that have been using the service. We also saw some folks in the chat talking about how valuable this UberHealth intervention could be. And now we're going to get to hear it straight from, frontline health leaders in clinics that are providing these rides. Sostento works with around 100 free and charitable clinics across the country. These are nonprofit health providers who are driven by donations and volunteers. They are really an inspiration to Sostento. They're the main constituency of frontline healthcare workers we serve, and we've been very, very grateful to be able to work with them and support them throughout the pandemic. We worked with 15 different clinics on our first year pilot that we were able to run with these UberHealth rides to increase vaccine access. We selected these clinics to get a diversity of types of clinics across the country. So we chose 15 clinics, 6 different states that serve different types of populations. So all free and charitable clinics exclusively serve families living below the poverty line. But we had clinics that supported a majority African-American population, some that served majority Hispanic speaking, as well as some rural areas. So we had a mix, and the results have just really, really been amazing. And I don't want to talk too much about it because I have 2 clinic leaders that are going to come on and talk to us about why these rides are so special. So let's bring on our 2 very, very special honorary guests from our free and charitable clinic partners. Okay, welcome. This is my favorite part of any kind of webinar or live stream, is to get to talk to those who are on the front line, give us their insights, share about what they're seeing. So I am just so thrilled to have Marisol and Molly here with me today. I'm going to let them introduce themselves. So first with you, Marisol. Marisol Resendez, the Executive Director of El Milagro Clinic in McAllen, Texas. If you could give us a little introduction, tell us about yourself, your clinic, and the type of population that you serve.
Yes, hi, and thank you, Joe, for having us here. My name is Marisol Resendez, and I'm the Executive Director at El Milagro Clinic. We are located in McAllen, Texas. That's South Texas, right on the border with Mexico. And I've been here for 17 years, since 2005, and I started volunteering during summer breaks from college, and then I started helping out in the prescription assistance program, and then I kind of became support staff, and then administrative assistant director, and now executive director. And so I quickly fell in love with the kind of patient population that we were serving. And these are, like you mentioned, Joe, uninsured, very low income, living below the poverty level. And so we have about 42% of our patient population is at or below 100% of the federal poverty level guidelines, so very, very low income. And the clinic does integrated behavioral health. And so we have counselors on site, we have nutritionists on site that are able to help our patients more fully. And since COVID, we've had a COVID testing site, and we've provided vaccines every day. We also have a mobile unit that goes out and provides, both testing, vaccines, and our medical services out to the community. We have over 900 colonias in the Rio Grande Valley, and so we go out to those remote areas and try to bring our services. And this program, the Uber Rides, has been so helpful for us and for our patients. It's been amazing.
Thank you, Marisol. Molly, over to you in Montgomery. Tell us about yourself, your clinic, and who you serve.
Great. Thanks for having me. My name's Molly Stone. I'm the director at Medical Outreach Ministries. We're the free clinic that serves 3 counties around Montgomery, Alabama, and we are in the south central part of Alabama. We provide primary and specialty care here in the clinic for about 1,000 patients each year. In addition to primary care, we have an on-site pharmacy, and we also do physical therapy, mental health counseling, case management, and we have a nationally recognized diabetes self-management education program that is extremely helpful because we have so many patients with chronic disease, including about 44% of our patients have diabetes. And so we deal a lot with diabetes and chronic disease. We moved our clinic to a larger location in March of 2020, and we reopened exactly 4 days before the first confirmed COVID case in Alabama. And so it threw everything that we had planned off course, but our volunteers and staff really rose to the challenge, and we were able to keep moving through all of that uncertainty. It forced us to make some changes and improvements that we implemented some new tools, and Uber has become kind of one of those along the way that has changed the way we operate. But it probably would not have happened if COVID hasn't come into our lives, or certainly wouldn't have happened in the same time frame. So we've been able to really help protect the health of our vulnerable patients with COVID vaccines and COVID education, especially those that are so high risk because of chronic conditions. So I realized today that I first connected with Sostento, with Joe, exactly 2 years ago tomorrow. So we are really grateful to have worked together on several COVID programs. And we actually have our first bivalent booster clinic this afternoon and have several patients coming in Ubers. So it's been a great partnership.
Thanks, Molly. And I remember it was almost a year ago that I came to visit your clinic, and we ran a vaccination event in your parking lot, complete with barbecue. I think I would call it gospel rap. I think that I would call the genre of music we had, giant Jenga games, and of course, some first timers I remember that came and got vaccinated. So that was really, really exciting. Quickly, we're going to get into the rides, but I want to put up 2 comments here just that continues to talk about the need for these rides at free clinics. We have Lee, who talks about the lack of transportation, the hours on a bus sometimes an individual needs to spend. How difficult can that make it to get to the clinic when it's open and make it on time for your appointment. So Lee, thank you for sharing that. And also Sharon, who sees the opportunity with the social determinants of health, accessing nutrition services with the rides. Yes, Sharon, we are also very, very excited about that. Thanks for sharing. So let's get to some stories about who is using these rides at your clinic, who is deploying the rides. So Marisol, we'll go to you first. Could you talk a little bit about the individuals using the rides that have made the most impact, and how it's worked at your clinic?
We've used it for, different kinds. And so just here at the clinic, for example, we have some patients that come and get seen by the doctor. And then we share a little bit of information. Some are still not wanting to get vaccinated. We've gotten through most of them though, but I remember this one male patient, and he's older, and he would ask questions about the vaccine. And then one day he came to his doctor's appointment and he didn't have a ride back. So we provided that for him. We said, well, we have this available. If you need a ride, we can go ahead and arrange that for you. And the next day he called and said, I would like to learn a little bit more about this information, because he took some flyers with him too. And so I'd like to learn a little bit more, and I would like to bring my daughter with me so that she can hear. And I said, oh, okay, sure. Yeah, you could just walk in. That was the answer by the staff. You can just walk in. No. We have no way to go. Would you be able to do that right for us again? And so we did, and he did, he got the vaccine. And so that's just one that while they're here, and we had the flyers about, no transportation for vaccines, make sure you ask. And so slowly but surely we were able to help more and more people like that. And so when we're out with our mobile unit, and this was a big one for me, because I was like, okay, so we're coming to them, and we're also using UberHealth. So when we're out in the community and we're at a specific site and somebody wants, we're providing vaccines, right? And then somebody's like, oh, that's not the one that I was thinking I was going to get. I was going to get, Pfizer, and you guys have Moderna. It's like, oh, no problem. I can get you the Pfizer. Let me just arrange a ride. Did you come walking? Did you need a ride? Let me do that for you. And we've done many of those where we've prepared a ride out in the community. We've arranged that. They come and pick them up where they're at and take them to the nearest pharmacy or wherever we found them an appointment. Same thing for the children's vaccine, for example. We got the parents, but we didn't have the children's vaccine at the time. And so it's like, but no worries. Can you go now? Because we can arrange that. No, maybe in a couple of hours. Okay, we can schedule that also. And so we were able to do that for them as well. So many, many different ways. It's just been our way, I think, and it makes me so happy that we're able to do this, because it's been our way of saying, oh, no problem. That is not a problem. Let me get you the answer. Let me get you the solution. And it's been almost that big that push for a lot, because that sometimes they say, no, because transportation, but it's not really transportation. It's transportation plus everything else that is going on in their lives and all those social determinants that we were saying. So just the fact that we're able to give something as easy as, no, you're ready now. Let's do it now, and we'll get you on your way. It's just been a blessing.
Yeah, I think that one of the things that, for people to access healthcare, you need convenience and flexibility. I mean, if you have a car, you live close to it, you have insurance, you already have that, and you kind of take it for granted. So Marisol, I totally agree with that. I also think it's interesting you mentioned that with the UberHealth platform, you can do an on-demand ride. So, you need a ride right now, let me order it for you, or you can schedule it ahead of time. So I think that flexibility is also really, really important. And I want to shout out to that. Marisol, I remember right when we started the rides, when we got our CNN coverage, and CNN came and they told a story about someone who used one of the Uber health rides to get to the clinic. So that's just remembering how exciting that was when it happened as well. But Molly, maybe you can tell me now a little bit about, how the rides have been working with you, some individuals you've seen using the rides, the biggest impact rides that you've had to date.
Yeah, absolutely. Well, what Marisol was saying sounds very familiar, because I was talking with some of our staff yesterday, and one of our staff members said the best thing is when he's on the phone with somebody and they're saying, I'm confused about my medication, or I have this new issue, I really need to, and he says, they want to talk to the doctor or talk to the nurse or something like that. And he says, well, it sounds like you really need to come in. And they say, well, I can't come, I don't, and it's transportation, 9 times out of 10, it's transportation. And they don't have their own. And so they've got to go through several, how am I going to do it? How am I going to pay for it? Even if it's a friend or family member, we know that sometimes people charge each other, for rides and things like that. And so it's not just, you would think, sure, I would come and pick you up. I would go pick my friend up and take them to their health appointment. But if you're low income and then that takes your gas, and gas is so much more expensive now, and so that barrier is such a huge barrier. And for our staff to just be able to respond with, we can help you with that. That's no problem. Like, you don't have to worry about that, has just been just fantastic, just key to getting so many people in here and to be able to provide that vaccine education along the way. Just to be able to do that just eliminate that barrier has been huge. And we actually have one patient who recently exited the clinic, and she had been our patient since 2017, and she had really uncontrolled diabetes. But she had worked really closely with our nurse practitioner and our diabetes educator. And the other day she had her exit appointment, and she has lowered her A1C from 14 to 5.6. Over 14 to 5.6. So she has had all the success with her health. And she worked as a commercial driver, and her eyesight had really deteriorated. And so she was driving herself to her appointments. And our diabetes educator said, you can't do that. You can't see. She really couldn't see. And so we were able to connect her with an eye doctor and get her cataract surgery. And with her improved eyesight, she can go back to work. She got insurance, so she's no longer our patient, which is the goal, and really a success. But she was able to use several Uber rides for some of her appointments, and with her COVID vaccine and all that, that eliminated that danger. And then, she was able to eventually get the surgery. So, that really contributed to her having some major success in her health.
Well, what a wonderful story of someone who sounded like they need driving for a living, got some rides to be able to get back to where they could work again. So right. in a minute, I'm going to ask you both about how this works at your clinic, and maybe we can bring up the view of where all these clinics have taken, rides have taken place in each of the cities. So maybe we can prep that. And as Marisol, you and Molly, I'm going to ask you about the clinic operations. We can see the spread of the ride. So we're going to look I think we have that, I believe. We'll be able to show where these rides are taking place in each of your communities. So if we can get those, bring it up. And I think we'll start with, Marisol, here are the spread of rides that you've done around McAllen, Texas. So as we're looking at this, all these rides you've been able to do all around this area, how did you get it done with your clinic's operations? How did you, integrate this into what you've been doing? And here's some of your stats. So it looks like you got 790 rides done, 3 different people implementing those rides. Maybe you can tell us a little bit about how you got this done internally at your clinic.
Yeah, so it started with like we were saying, it was really good that we got to do it. We actually got to do it and go in the ride so we could see what the patients were going to experience. But I know that I did a lot at the beginning, and then we kind of just asked the front office to start doing it because they're the ones that answer the phones. And so specifically, there's this one gentleman, Jesse, that he's the one that's been helping us. So that's what we did. At the beginning, it was pretty much of like, okay, whoever gets it, this is how you do it. And we provided training for all of our front staff. But then pretty quickly we figured, you know what, we need a point person, UberHealth champion to do this work. And so that's what's been working best for the clinic. And so he's able to do that. And whoever goes in the mobile unit, and we take our laptop with us, and that's who does it. Whoever the MA or the entry data person is for that trip, but it's usually one person, Jesse, that does it.
So it sounds like you have one person that kind of does the screening and is your point person, but it sounds like you've trained multiple people across your staff, volunteers, to be able to, if I think there is something when you have someone that's like, oh, I might come in, but I don't have the ride. And you're like, well, that's not your excuse today. You kind of don't want to wait till someone else to follow it up. So it sounds like you have trained across your clinic staff. Everyone can order the ride. Is that is able to know how to do it, or is that how it works?
The 4 people that are in the front office know how to do it. But anybody that answers the phone or anybody that's here at the clinic and says, I would like to learn a little bit more about this, but I can't come in. It's like, no, let me get you. I believe we have a program. So let me get you, even if it's the counselors or the nutritionists, the providers in the back, everybody knows that there is help with transportation. And again, there's flyers all over the clinic about it too. If you need any COVID related information for vaccines or anything like that, we can get you here. And so they know, and they will transfer the call to the front to make sure that we arrange that right for them.
Nice. So it sounds like you have advocates, awareness across the organization, a few individuals that can then implement it. That's cool. Okay, Molly, how are you doing? We'll bring up your stats here in just a second so we can see what your clinic has done over the last year. Here we go. So this is Montgomery, Alabama. Look at that spread. I see you got a lot kind of in the central area of the city, but then on the periphery, it looks like you have people coming in from the periphery as well. So this is the spread of your rides, where they've happened, and then let's take a look at your stats. So you are over 1,000 rides. I thought you had passed that 1,000 ride mark there, Molly. Over 1,100 total rides. But what also is interesting, maybe you can speak to, it looks like you have people taking multiple rides as well, because you have 141 unique riders and 1,000 rides. That means there's an average around 10 rides per individual. And we know for any kind of service, convincing someone about the COVID vaccine, especially, it takes multiple trips sometimes. They want to get other healthcare things taken care of, and eventually we can convince them. So yeah, tell me a little bit about how you integrated into your clinic, how it's currently working, and how you've achieved this amazing stat of over 1,000 rides completed in the last year.
Yeah, well, we too have our entire front office staff is able to schedule rides. And when we did first start, there were just a couple of us that learned, including me, but I rarely schedule them now. Our front office staff has taken that over, and it is because the people who answer the phone are the ones that have the patient and can say, like you were just saying, oh no, I can do that for you right now. And also, sometimes the patients need help in real time, with what kind of car is it going to be, or where do I need to stand, or the patients sometimes need a little hand holding and to get through it too. So if they're unfamiliar with it, and so they're able to do that and be more on the spot. So everybody in the clinic does suggest that people take rides and and promote the program if the needs are there. But those 4 people up front really make it happen.
Mm-hmm. So it sounds like that ride dispatcher, I call it, is like a key role. And that individual needs to know not just how to use the technology platform, but needs to know some of the challenges a first-time rider might face. So maybe I'll follow up with you first, Molly, and then Marisol, I'll ask how you work on this. Are there other implementation barriers that you see around individuals that don't have experience with rideshare or have never heard of it before? And how do you overcome those? It sounds like that dispatcher does more than just programming the ride, but they may be in the car telling them about the car. So tell me a little bit about that.
Yeah, sometimes we have issues with the patient because we schedule them. The patient can't track it. They don't watch the little car move on the map like we do. And so sometimes we'll need to stay on the phone with the patient and say, okay, they're coming, and make sure you're standing at this corner or something like that. And we've had a few miss rides here and there with patients that, were on the wrong side of the building or the wrong side of the street, or maybe it's an apartment complex and they didn't go all the way to the front or something like that. And so it's a little bit of a game of telephone sometimes between the Uber and the computer and then the patient and us. And so there's been a little bit of that, and that's taken some learning curve. But one thing we've noticed is we get a lot of repeat drivers. And so, just around the city. And so they have really learned where the clinic is for sure. And then, some of being able to pick up some of the patients. So that's been helpful to have drivers that just seem to be really nice and easy to work with.
Yeah, no, that's one of my ideas for the future, is that if clinics can be able to choose their own driver, and I know Leor is in the back going, I know, Joe, I know you asked me about this multiple times, but one of the future use cases of the rise that we're thinking about is behavioral health, right? Someone who's coming maybe to a substance misuse appointment or going to some other kind of mental or behavioral health service. And that's one where the driver understanding who is in the vehicle may become very, very important. And, I know that I've spoken with some clinics that have their mobile units. I know, Marisol, you mentioned you have one, or that do this transportation, other means through a van or other means. Say the appointment starts the second the individual gets into the vehicle. That's an opportunity to have conversation with them. So yeah, Mo, that's cool to hear that the repeat drivers, at least they don't get lost. They know where they're going. And I think maybe they get some satisfaction to their bringing people to their health appointments to get access to a service like the vaccines. That's pretty cool. So Marisol, tell me about any of the implementation challenges around using rideshare and how have you overcome them?
We had much like Molly, now get the repeat drivers, which is great. That's been one of our best things. They know where the clinic's at, but also that dispatcher for us has been really working, doing creative things in creative ways. So he usually puts on the memo for the driver, please call as soon as you get to the clinic, call the patient, or call the rider. That's what they put. Please call the rider. That's if they don't have a smartphone. They do have a smartphone. They put, please text rider when you arrive to El Milagro. So that's been helpful. That way they know. And, if they're anywhere around the clinic, not really outside waiting, they're able to just kind of walk out, and okay, your ride is here. That is one. The other one that that they do, for example, the other day I said, Jesse, did you know if we can get somebody with a wheelchair? They really want, and he said, ma'am, I know that I can ask for a ride for 6 people and they will send a big SUV. And so he knows, so he's been trying to do different things. And sure enough, you get a big van and you're able to get in that wheelchair in. And it wasn't somebody that couldn't walk, but it was just, they needed the wheelchair with them. So different things that we've tried, and we worked around it. We know that when we have a good resource and we know how to identify when we have it, we work around those issues. So for the most part, it's been really good. Another one, I think it's when requesting a car or a ride from a very remote area and we don't have many cars out there. And so, can we request it here and perhaps have somebody go over there, things like that. But those are, we had mainly challenges where we couldn't get the patient here very early in the morning. And so for those patients that needed to come in and they were coming in from far away requesting, coming in for vaccines or anything like that, or just education or food pantry. We were doing food pantry and we were trying to get a lot of our patients to learn about the COVID vaccines at the beginning. So we were doing it in their food pantry when we were distributing the food. And so when they requested to come get their food, we just kind of scheduled them in the afternoon. And then that's where it seems to have more cars around other areas, right? Not too early. So that's another thing that we tried.
Excellent. So I'm going to ask one more question of both of you, and then we're going to bring Leor on for our roundtable. So if you're in the chat, I know at the hour we lose a few folks, but there's still, I think, nearly 60 individuals here listening live. So if you have questions for Marisol, Molly, or Leor, you can put them in the chat, and we will answer your questions. We've also collected some of the questions from you, so we have some to get going with. But I'm going to ask you one last question, and then we'll bring Leor back on. And this is about the future types of rides that you're most excited about. So, we've been very focused doing the COVID vaccine access. It really has introduced us to this platform and the power of it. But now for next year, we're really thinking, how do we expand these rides into health access rides, a more general approach for different kinds of rides? So I want to hear from both of you. Molly, we'll go to you first and we'll go back to Marisol. What types of rides are you most excited to try out next year if we're able to mobilize some more funds? What type of ride are you most excited to experiment with and expand into? So Molly, you first.
Yeah, gosh, we've been talking about this, and the sky's the limit, really. But one thing the first thing that comes to mind is medication delivery, because sometimes our patients just can't get here to pick up their meds, and their meds sit on our shelf for weeks, and we know they need it. And so and we think that could be done in a much more efficient way. One person could be picked up, like you were saying earlier. I think you could even send a staff member to deliver medication, that would be fantastic. We also have 2 partnerships right now. One is a long-time partnership with our YMCA that offers very low-cost vouchers for our patients, and so many of our patients need access to fitness. They might live in neighborhoods that aren't safe to go walk in or something like that, and so but if they can't get there, then the voucher's not going to do them a lot of good. And so it would be great to send patients for that kind of service. And then we also have a program right now that's giving our patients produce gift cards. And so to purchase produce. And so if we could get them to the grocery store to be able to spend those, that would be fantastic too. So really anything of those extra that really do address the social determinants of health, any of those extra kind of services along the way would be super.
Cool. Thanks, Molly. Marisol, over to you. What are you excited about?
Yeah, same thing. I think that this is just a great program that I would love to see expand beyond just COVID. And I know that there's a huge need, like Molly was saying, sometimes neighbors ask neighbors for a ride or family members. And we had a lady that said, I have to iron their clothes for a week, so I can't afford to do that. I have other, with my child and things like that. So just kind of expanding it to all of it, being able to not miss or delay any healthcare. And we know that access to transportation, contributes to communities, the economic development and health and quality of life, and all of those social determinants that we are focused on in order for them to get better, to get their health.
Mm-hmm. And on my side, I think one of the ones that I'm most excited about to explore further is preventative screenings, because I saw that, something that prevents disease like the vaccine, if it's not convenient, they're even less likely to go pursue it. We know that an individual, this is something I learned from my very first project I ever did that involved transportation. It was in rural Uganda. And what we found was in the really rural areas, an individual would never seek care unless it was acute because of the distance they would have to walk. And so they would often wait for something that could have been prevented, that could have been mitigated, but because they didn't have convenient, reliable transportation, they waited till it was serious enough to go to the clinic. And by then, actually, oftentimes the clinic couldn't help them because it was so serious they had to travel even further to go to a hospital. So for me, the convenience that we could create around preventative screenings, that might be getting patients to the clinic, but it may also be able to get staff into the community to do the preventative screenings. The other one I think was mentioned before is the social determinants of health. And for me, especially about chronic disease management, I think maybe Molly, it was you who mentioned this to me, or somebody said, Joe, when someone comes in with a chronic disease, it's often, again, for the acute care. And it's hard for them to say, like, the wraparound care, often that it's called, of like, listen, to deal with your diabetes, we need you to see nutritionists. We need you to go to the gym. We need you to get fresh food. They say, well, that's not going to be easy. But if you say, hey, I can give you rides, we can get to those things. And actually, the way that I see it is that's about self-management. Maybe that person will feel a little more empowered to take control of their health if we eliminate the transportation barrier. So those are the two that I'm interested to kind of explore more, along with some of those ones that you've mentioned. With that, let's bring Leor back on and see if she's any. Hey, Leor, welcome back.
Hello.
Any comments on the things that we've been talking about? Again, if anyone has questions, I saw there's one question here. That's more of a comment. Get me on the waiting list. Lori, I know Ratika in the chat's there. We're going to get you on our waiting list. So we'll do that for you. But Leor, anything you heard from our
Well, I first wanted to say thank you. We work on this, but aren't necessarily on the ground working with the patients who are benefiting. So I really appreciate hearing the stories of real life people who are benefiting from rides. So thank you for doing the work to incorporate this into your clinics and for sharing a little bit about the patients who it's impacting. It validates the work that we're doing is making an impact, and I appreciate hearing it. And I think the use cases that you guys have talked about are also what we're thinking about, the SDOH use cases, the prescription delivery. So it's spot on in terms of how we're thinking the product is intended to be used. So it's good alignment that that's actually what the need on the ground is as well.
Mm-hmm. Great. All right, so let's get to some of these kind of questions from the audience that I've already put out. We've answered quite a number of them, but how about this one? This is kind of a simple one, and I'll go first to you, Molly, on this one, and then Marisol. When you have someone who's never heard of rideshare before, who's never heard of this thing, how do you introduce it? how do you talk to them about it? Like when you're first introducing, not even like the rideshare, how do you describe it? How do you communicate in the way that they understand? So Molly, if someone comes in and goes, I don't know what you're talking about here. What is this? How do you even explain to the patient what rideshare is and why they should use it?
Well, I think probably relating it back to, I mean, everybody knows what a taxi is. And so we can at least start there and say, you know, they're going to pick you up like a taxi would, but this is how it's going to work. And you've really just got to go step by step, because we do have a lot of people that don't have smartphones, or if they do, they don't use them like some of the rest of us do, you know. And so the one thing that really helps is when the Uber, we have it set on our UberHealth where it calls them too. So if they're not a big texter, then they get kind of a robocall kind of thing. And so so that's another good piece of it. But we really just have to break it down and, you know, and assure them that, you know, since we have built some trust with them, and so, you know, with that they trust us, so they'll trust this ride, you know. And so it's really on a case-by-case basis. I don't know that we have a kind of general method that we use every time, but different patients have different reactions.
One of the things I've seen as a super skill of the free and charitable clinics is you have a variety of volunteers and staff that can also communicate in different ways and work with different patients. I know, Molly, you know, I have an affection for your staff, and
Right.
I've seen them in action. And it is that trust, right? That trust level of, if you trust me, then let me describe this to you and how it's going to work.
Right.
Marisol, anything you would want to add there of how you kind of, to people, you know, maybe have never heard of it before, a little hesitant, because you're on the border there with Mexico. So I'm sure there's even some additional trust issues if an individual is, you know, maybe is worried about documentation status or other things, you know, getting into a unmarked car, maybe something that can be scary to them. So how do you kind of explain it to someone if it's their first time ever using something like this?
Yeah, so it actually happened to me particularly. I'm sure it's happened to the staff, but as I was out in the community at a health fair, and we were providing vaccines and just education for diabetes, we were also having these people, like I mentioned, like community members asking for the vaccine, and we were sending them some. So I said, no, I can send you an Uber, and I could see their face like they did. And then so I changed it, and I said, you know, le mando un carro, like I would send a car for you to pick you up. And then they were like even worse. And I'm like, okay, this is not the best. So I said, no, like a taxi, but it's a private car, and it's like a taxi, but it works the same way. And I will do it for you, and I will be monitoring your travel. And so if it's okay with you, I would like to do that for you. And yeah, you kind of take it, but sometimes it can be, so you have to be careful. Again, it happened to me. So maybe I was just like getting too excited that they were needing it, and I could offer it, that I said, no, yeah, I'll send you an Uber, and then I'll send you a car. And so you really have to because not everybody's on the same page as you are. So.
Thanks, Marisol. I'll see, Leor, if you have anything to add, but we have another ready for the waiting list. Teresa at Crossover, another free clinic, you know, is ready to jump on. And Vicky, thank you for joining us. I know another free clinic leader, very informative, awesome. Leor, anything you would want to add there of any tips or tricks of, you know, the first time you're trying to educate someone on just the basic?
Well, my grandmother thinks I work for the free taxi company because you get out of the car and you don't pay. So, no, the thing I would add, just in case for those who haven't seen the product, also is that the landline calls that were mentioned, and also the text messages, are also available in a lot of different languages. So you can have the riders get text messages, and I think it's nearly 20 different languages, so that they do get information. And the other thing that, and I'm curious actually if either of your clinics do this, is that we've seen organizations have printouts where, especially if someone's leaving an appointment at the clinic, to almost basically make almost like a Post-it note that's customized, that has the driver's name or license plate, like on a little Post-it note. So whether they're going outside or with a staff member, they can physically, like especially if they aren't as tech savvy, have a little note that they can compare and actually look for that license plate number. We joke that we're one of the few technology companies that knows that there's still importance in paper in our industry. So we have actually on our website downloadable templates if anyone wants to use. But we've seen some organizations do that as well. It obviously doesn't work when someone's coming from home, but if they're going from the clinic.
That's a great idea. Thank you so much.
Yeah, and that's, I think, one of the things that we're learning is that, again, we kind of talked about the operations side as one barrier, and the other thing we need to continuously do is the individuals that need the rides the most are also likely to be the least potentially tech savvy, and so we need to think through. On our team, we do a design process where you just have to listen first and not assume. I remember early on in this project, again, people were like, rides? Why do people need rides? The vaccine's available almost in every corner. And so there is just that education and the different education approaches, along with integrating into your operations, I think is really critical to success. So we're almost actually at time here. I do have one more question. Again, if you have any questions in the chat there, let us know. I can try to sneak that in. Is there any segment of your clinic population, Molly, we'll go to you first on this one, that you're seeing take advantage of the rideshare program? So is this like, so you see a diversity of use across your clinic population, or are there kind of specific groups you've seen benefit most from the rides?
I think it's a pretty wide range. In fact, when I've looked at the list of patients, on the reports and things, it kind of cuts across all of I would say it probably skews a slightly older, maybe and maybe people that don't feel as comfortable driving, so, but I think it's pretty across the board.
Nice. Cool. Marisol, any specific, again, because I'm thinking about maybe clinics getting started, they want to target a specific population group within their subpopulation group within their kind of, clinic service area. Is there any groups that you saw, benefited most, or that, you kind of have gravitated towards the service?
I think the older population here at the clinic, and I think women out in the colonias are the ones that are using it. They don't know how to drive, and they're really needing that access.
Can you give us a little more information about that? So I know what the colonias are, but maybe tell us a little bit about that is and why those rides are important for those women. Tell me a little bit more about that.
Yes, so colonias are unincorporated neighborhoods out in remote areas or rural areas. And we have, like I mentioned, over 900 of them along the Rio Grande Valley. And so the women out there, they either, they have one vehicle per household, perhaps, if they have any, and it's usually the man that goes out and works, and so they are left at home, and it's very remote and it's very far away. Those are the trips that you saw on the map that are like spread out. And so distances, they don't have like grocery stores around them or anything like that. And so they don't know how to drive to, they don't have a vehicle to drive. And so those are the ones that have no access to getting to a pharmacy to get a vaccine, or to even, like I said, food. They need to wait for their husband to get it.
Thank you, Marisol. Yeah, and that's one of the things that we've seen is that, we want to continue to investigate. The question we always get, Joe, does this work for the rural areas? And I think that the answer is long-term, yes. Short-term, there are different types of barriers related to the rural areas, which is the availability of the drivers, the cost and distance of the rides. So if you're in a rural area, we know we have some clinics there. I think that we're going to want to work together to design how it works for the rural areas, but I believe it can. I've also been having one of my board members tell me that satellite internet is going to be huge in the next 5 years, and that connectivity issues in some of these rural areas are going to be resolved through the satellite internet. I know that that's a barrier as well for some of these services in the rural areas, but thank you for mentioning that, Marisol, that that's possible, and that people are benefiting from longer rides from the rural areas. Maybe cost a little bit more, but the impact is there with that group that you mentioned. So Leor, I'll go for you for the last word, and then we're going to close out with some closing remarks from me. Anything else you would want to say to all the clinics, the groups that are here thinking about the service? Any last piece of advice that you would have for them?
No, we just though that we appreciate all of the hard work that you're doing on the ground on a day in and day out. The goal of UberHealth is just to make, we know even these front desk folks who are the ones taking the calls, that's probably like 2% of their entire job. And that there's so many things that you and your staff are handling on behalf of your patients. And so our goal is to try to make this one little piece of actually getting people to their appointments a little bit easier, but really just a thank you to all the work that you're doing on a day-to-day. We know that we're a very small piece of all of the things that you need to think about. We want to make that piece as easy as it can be for you all.
Well, I think that's a great one to close on from our guests. So Marisol, Molly, Leor, thank you for spending the afternoon with me. It's been really interesting, engaging. We've got some converts in the chat that are on our waiting list now. And, we really are raising awareness about this service. I think into the next 5 years, it's just going to continue to grow, continue to bring value. And you all are the pioneers on the front line with us. So we appreciate it. We have Amber here also echoing that. Thank you, Amber, for that. We appreciate it. So I'm going to let our guests off the stage get back to work on their day. So thanks. All right. Well, everyone, this has been our second Sostento Live. Thank you so much for joining us. Sostento will be continuing to do 2 more Sostento Live public sessions in the next 2 months. So we are tentatively planning for the next Sostento Live to be the last week of October. And then our final Sostento Live will be on Tuesday, November the 15th. So for that last week of October session, we will be focusing on data, the power of data, how we can collect data with health workers, how we can make that data actionable. So Sostento has been really upping our data collection game, and we are going to be sharing a data dashboard that we've created that we collect data from some of the hardest to reach individuals across the country. So that will be really, really interesting to show that data, talk about how we're using that data, and hopefully, share some insights from that. In November, we are going to be having a very special live event about combating and raising awareness around burnout among health workers. We know burnout is a huge issue among health workers. And so in November, on the 15th, we'll have some very special things planned for our Sostento Live session, the last one of the year on Tuesday, November the 15th, to, again, talk about healthcare worker burnout, how we can combat it, how we can reduce it. So if you stayed with us to the end of the live session, you get the most up-to-date information, but you can be on the lookout in the upcoming weeks, a follow-up email with the highlights from today's session, as well as invitations to our next webinar. So I want to thank everybody for tuning in today, and I hope to see you at the next one. Take care. Ciao. Bye.